Hello, I'm Dr. Huzefa. I'm a physician and pulmonologist working at Hamilton Bay Hospital. Today I'll be speaking about viral hepatitis. Viral hepatitis means the hepatitis, that is the inflammation of the liver which is caused by viruses. The most common viruses which cause viral hepatitis are hepatitis A, hepatitis B, C, D and E. There are various forms of transmission of these viruses. Hepatitis virus A and E is transmitted by through contact, by hand-to-hand contact, and hepatitis B and C is transmitted through blood transfusion or sexual contact. So the common hepatitis we see are hepatitis A and E. When people eat food outside in an unhygienic condition, they tend to get these hepatitis. So the symptoms starts with fever. They get fever for 2 to 3 days and then they develop yellowish urine, yellowish discoloration of eyes, and they have nausea and vomiting. They lose the appetite, and that's how they come to the doctor. They also might have loose motion. And whereas hepatitis virus B and D is transmitted by blood transfusion or sexual contact. So usually we see these in families. So when there is hepatitis B, some members of the family are affected because they have very much contact with each other. So through any cuts or bruises, it can spread to other family members. Also, this can be spread by blood transfusion, but nowadays they check for these viruses before the transfusion. So the transmission rate is almost nil through blood transfusion. The other method by which it is transmitted is through saloon. So when you go to a saloon and they use old razor which is used with other customers, you tend to get these viruses through transmission. Hepatitis A and E viruses are acute viruses. They don't cause chronic liver disease, whereas hepatitis B and D, they tend to cause chronic liver disease. That means the virus is present in the body even after 6 months. So usually after 6 months people don't have any symptoms, but the virus is still present. But over long term, over decades, like 2 decades, 20, 25 years, they tend to develop chronic liver disease. Means the liver function is very abnormal, and very rarely they might develop hepatic cancer also. So the thing is, people should get vaccinated against hepatitis B, which is commonly available, to prevent these kinds of complications. And there is vaccine against hepatitis A also. So we advise people to take both these vaccinations to prevent these deadly complications. Thank you. Hello.